This is the initial appointment of a patient who comes to me with gait problems, meaning walking disabilities, and all the typical symptoms of a Tourette's patient. She also has the symptoms of a TMJ patient. You can see in this video she is using a cane. She also described to me that she uses a walker also when her condition worsens. You can see the MRIs of her on the view box in the background. We never, ever initiate treatment without MRIs on these patients. This is the very next day. What we wish to accomplish on this is a diagnostic workup, which means a bunch of very sophisticated tomographic x-rays through the temporomandibular joints, impressions, and possibly her splint delivery. She comes with all kinds of head movements, hand movements, foot movements, and pain. Notice the uncontrolled movements of her hands, feet, and head.
She's holding her head up. Drives her insane.
Okay.
Tell us what your symptoms are so we can record them.
I feel really, really tense all through here, and I can't stop twitching, and my eyes blink like crazy. And it shakes, like the back of my skull almost like shakes.
And how long has this been going on?
All the time.
Years? Or?
Well, I didn't shake like this. I just didn't have until I started screwing around with my mouth TMJ stuff, but I didn't have any motion in my neck, and I would get horrible neck pain and stuckness, like torticollis thing, and migraines. Now those are getting better, but I twitch a lot. If I'm not somehow supported, so I like put pillows under my arms and under my head and stuff, but raising my mouth seems to help stop twitching. I still get twitching sometimes, but not like this bad when I have something in my mouth. And opening it wide hurt.
Constant eye blinking and head twitching are cardinal signs of Tourette's syndrome. Pain upon opening or limited opening of the mouth are cardinal signs of internal derangement of the temporomandibular joint. Many times these patients will present with symptoms of both Tourette's and TMJ internal derangement. I have had the patient using tongue blades in her mouth to determine what the vertical dimension is, so that I know at what vertical dimension to construct the lower splint. At this point in time, I am delivering the lower splint for the first time. Okay. Will it see?
Yeah, there's one like there's a high part right over here, but otherwise it should be much better, like the left and the right side seem.
You like this, huh?
Yeah. Sorry. In here sometimes looks like it gets a little like...
As I take the appliance in and out of her mouth, adjusting it each time, notice that when I insert the appliance, her head and facial movements and blinking greatly diminish. And then when I take it out for the adjustment, they return. And then when I put it back in the next time, they greatly diminish. You breathing better? Okay. Let's see you get up and walk. You think you walk?
Okay. I wasn't walking as much normal when I came in. Just,
Yeah, I didn't see it come in, but were you walking when you came in?
She was walking a little bit funny. Like this.
Okay, turn around and... Is that any better at all than when you came in at 9?
I think it's a little bit better. I still feel it here, but I'm not. Well, it hurts just as much. I'm not quite as wobbly, I don't think.
Walk back over there. Many of these patients also suffer from low back or sacroiliac pain. This is due to sustained muscle contraction in this area. The patients invariably experience relief of these pains due to these appliances we make. We judge the effectiveness of the appliances by how they walk initially. Any improvement of the walk occurs in the first 2 or 3 minutes and then continues thereafter. And it gives us an idea of whether we're on the right track in the treatment of these patients. Believe it or not, this is an improvement in her walking. If you did not discern any noticeable difference, notice how her walking completely degenerates when I take the appliance out of her mouth. Not as good, is it?
I feel shakier.
Okay, I'm going to add to this. I have increased the vertical dimension 3 times in fact, on this patient. You can seem to get out of the chair a lot easier. Okay, turn around. Okay, let's leave it like this for today, and this should improve. Practice walking backwards at home, not here. Do that like 5 or 10 or 20 times a day, 10 feet across your living room or something. And people seem to adapt to it, improve quicker with practicing walking backwards.
Okay.
And,
Okay, this is the next day. Go ahead and tell us how you're feeling.
I'm feeling really well. Yesterday I went home and just napped for a little bit, and when I got up I could walk much better, more steady, and my low back pain was mostly gone. And I could do a little bit, like just leaning that little bit forward and back that normally kinks me up. I could do that, which was really good. And this morning I'm walking really well and sturdy, and my neck has calmed down. So, and I can actually look up and down, which normally, makes me twitch a lot. So.
And no spasming.
No, if I take this out, it will spasm. But this is pretty good for me to be able to lift my head up that far.
Okay.
And I don't have any. I'm walking pretty evenly.
Okay.
So really good.
Good. Let's see. So your hands aren't shaking anymore.
Nope.
Your feet.
Nope. Hold my head up by itself.
Okay, go ahead.
keep in mind that these results were obtained within 24 hours of her initial appointment without the use of medications or psychological therapy to suppress her symptoms. We are trying to treat the prime cause of her symptoms, which will be revealed to you as we go through this DVD. Okay. Her opening has increased to 46 millimeters. Yesterday it was 41 millimeters. That's a 10% improvement just like that. We're going to do a final adjustment and then send this young lady back to Cleveland. Jump shot. This is the final splint configuration. Okay.
Wonderful.
6 or 8 weeks, sweetie.
Yep, we got 6 weeks planned.
Okay.
Already in the book.
Good.
Thanks, you guys.
Bye.
Remember her initial appointment when you saw the MRIs hanging on the view box? These are MRIs through the left and right temporomandibular joints in both the closed and the open positions. The big question is, what did they reveal? Because you recall I told you that most of these patients were both Tourette's and internally deranged TM joint patients. And although we have addressed the Tourette's symptoms, it is not sufficient, in my mind, to do just symptomatic treatment. You have to address the prime cause of all the symptoms. It is now time to address the TMJ symptomology. The MRIs reveal that the discs within each joint were anteriorly dislocated without reduction. That means they were displaced to the front and did not go back into place upon opening of the mouth. This is why it hurt her to open and why her interincisal opening was limited. Although you may think 46 millimeters was a normal opening, to me it is an impairment of function. The normal opening should be 50 to 54 millimeters, in spite of what you may have been told by other people. So therefore, we now address the internal derangement, and we do this by open joint plication surgery. It has been my experience over the past 45 years that if you address only the symptoms without the TMJ dislocation, the treatment will have no stability and the symptoms will return within 1 to 3 months. Therefore, to provide long-term stability in the treatment of these cases, we must get the left and right displaced TMJ discs into their normal anatomical position in such a way that they stay there. And we do this through left and right open joint TMJ plication surgery. Those of you who are healthcare providers should know that it takes a very courageous patient to proceed with this step of TM joint surgery, because they have experienced such an improvement in their symptoms that they are afraid that they will risk losing this improvement if they go on to this additional treatment. To me, this is an irrational fear. It will only improve them if the surgery is done correctly. This is the patient 3 days post-surgically. She had a left and right open joint plication procedure. I've reviewed with the patient what her presenting symptomology was, and she's going to tell you the improvement.
I feel great. I'm surprised at how great I feel I can move without tremoring, and my back and my neck are not hurting. I can do the opening of my mouth without tremoring. When Dr. Stack was just measuring me and I, taking my appliance in and out, my head wasn't shaking, my arms weren't quivering, and I'm not in pain. I've been in pain for a very long time, so I don't even know how to explain it. It's really wonderful. Do you want specific?
You had trouble walking, right?
I had a lot of trouble walking.
Okay, why don't you get up and walk out there and then back, and we'll just...
I can get up and down without using a cane or a walker, and I can walk
Okay, see that?
with it a regular stride. I don't feel like my thighs are pulling on my back anymore. And I feel like, and my neck isn't sore just like all the time. Usually it's hard for me to just hold my head up.
Okay, do it one more time up to that. Right at the back.
What's the difference likely to be when she's off the medication?
Even better. Even better.
Getting really much
Yeah.
better. Except my chair's
Okay.
yeah.
Okay, we are rebalancing the patient's surgical splint to compensate for any spasm, muscle spasm, swelling, etc. And then we'll dismiss the patient and see her in the near future.
But since right after surgery, I have been just amazingly better. I had, for the last 10 years, I've had pain, constant pain in my back, in my neck. I've had debilitating migraines. I have walked bent over funny. I tremored. My tremors got so bad that I couldn't stand right. I was using a cane. Sometimes I've been sleeping on and using a massage table. I haven't sat on a couch in like 10 years. I have been through every physical therapy, back surgery, you know, steroid shots, pain blocks, everything, and nothing has worked. And the surgery, since I woke up from surgery, I could stand up, right up. I always used to have to push myself up with my arms, and I would be shaking. I couldn't look up in the air or to the side with my head, and I would blink like crazy, and my head would twitch to the left, and my husband would have to carry me around and get me up and down the stairs, or I couldn't go. I was homebound a lot. I couldn't drive a lot. I had trouble attending things, like just having trouble, you know, going to my family's weddings and things. So I was very non-functional. And since the surgery, I can walk. It's not pulling on my back. I don't have constant back pain. I don't have constant neck pain. I stride normally. I have had no tremors at all. None in my hands, none when I'm moving, so I can move up all the way, and that would normally make my whole body tremor, and I can look to the side, and I can stand and sit without having any trouble with my back, without using my arms to hoist me, and I'm walking upright, so I'm going to be able to get stronger, because a lot of my muscles didn't work the right way. For so many years of compensating, so now I'm just working on strengthening and getting the proper muscles to work. But it's truly amazing. My family, my doctors can't believe it. They're so excited, and I feel happy. And they say I'm like I used to be. My face and my movement, and it's just so nice not to have constant pain all the time and feel like I can't even get around my own house. So. I don't need a walker. I've used a wheelchair, and I haven't used that or my cane or anything since surgery. And if I think Dad, he hasn't had to carry me anywhere. So it's been wonderful. I'm really just excited to keep getting better.